Welcome to the virtual NP Weight Loss and Urgent Care. Today, we'll explore common health issues linked to obesity and how losing weight can drastically improve your health. Obesity isn't just about appearance. It impacts your heart, mental health, and overall well-being. Let's dive into the ways addressing your weight can lead to a healthier, happier life. Let's get started. Obesity, not just a food problem. Let's start by debunking the biggest myth. Obesity isn't just about eating too much. It's more complicated than that. While diet and exercise are certainly important, obesity is a multifaceted issue that involves genetics, psychological factors, and environment. According to the World Health Organization, obesity has more than doubled in prevalence since 1980, affecting over 1 billion people globally in 2024. This double burden of malnutrition, where people can be both nutrient deficient and overweight, is reshaping how we understand food systems. Excess weight is often linked to increased consumption of ultra-processed foods and a more sedentary lifestyle driven by technological advancements. But that's not all. Obesity's grip goes deeper, impacting everything from mental health to chronic diseases. Type 2 diabetes, the unwanted companion. Nobody invites type 2 diabetes to the party, but it often shows up when obesity is involved. In fact, 90% of people with type 2 diabetes are overweight or obese. According to the CDC, carrying extra weight makes it harder for your body to use insulin effectively, leading to insulin resistance, a hallmark of type 2 diabetes. The global rise in obesity has caused a quadrupling of diabetes cases since the 1980s, turning what was once a rare condition into a worldwide epidemic. Left unchecked, type 2 diabetes can lead to serious complications like blindness, kidney failure, and amputations. But the good news? Studies show that losing even 5 to 10% of your body weight can significantly reduce the risk of developing type 2 diabetes. Cardiovascular diseases, heartbreakers. If you think heart disease is something to worry about when you're older, think again. Obesity is a major risk factor for cardiovascular diseases, including heart attacks and strokes. In 2024, cardiovascular diseases remain the leading cause of death globally, with high cholesterol and hypertension serving as the main culprits. Here's the kicker. Every extra pound you carry forces your heart to work harder, increasing blood pressure and the risk of atherosclerosis, narrowing of arteries. In the U.S. alone, obesity-related heart diseases cost the healthcare system over $190 billion annually, and the numbers are only rising. Even a modest reduction in weight can lower these risks dramatically. According to the American Heart Association, losing 10% of your body weight can improve your heart's function, reducing the risk of heart attack and stroke by 50%. That's a statistic your heart will love. Cancer. Yes, really. Brace yourself. Obesity doesn't just mess with your heart and pancreas. It's also linked to 13 different types of cancer, including breast, colon, liver, and ovarian cancers. The reason? Excess fat tissue produces hormones like estrogen and insulin, which can encourage the growth of cancer cells. Research has found that being overweight increases the risk of developing cancer by 30 to 50%, depending on the type. One study published in The Lancet estimated that obesity could cause up to 20% of all cancer deaths by 2030. What's even more alarming is that obesity-related cancers often have poorer outcomes compared to cancers in people of normal weight. This makes maintaining a healthy weight even more critical, as reducing body fat can lower your risk of cancer and increase survival rates for those already diagnosed. Sleep apnea. Snore no more? We all know someone who snores like a chainsaw, and chances are, obesity plays a role. Obesity is the leading cause of obstructive sleep apnea, a condition where excess fat around the neck obstructs the airway during sleep, leading to breathing pauses. The National Sleep Foundation estimates that 70% of people with obstructive sleep apnea are overweight. And it's not just about snoring. Obstructive sleep apnea has been linked to other health problems like high blood pressure, heart disease, and even diabetes. Sleep apnea can also lead to chronic fatigue, poor concentration, and even increase your risk for accidents. Recent studies also suggest that untreated obstructive sleep apnea may shorten your lifespan by up to 15 years. The good news? Losing even a modest amount of weight can dramatically reduce obstructive sleep apnea symptoms and improve sleep quality, leaving you and your partner well-rested and healthier. Mental health, the hidden toll. While we often think of obesity as a physical issue, its effects on mental health can be equally damaging. Studies have shown that individuals with obesity are more likely to experience depression, anxiety, and low self-esteem. The stigma surrounding obesity only exacerbates these feelings, creating a vicious cycle of emotional eating and further weight gain. The link between obesity and mental health is complex, but research suggests that losing weight can improve mood, reduce anxiety, and enhance overall well-being. The American Psychological Association notes that psychological interventions, such as cognitive behavioral therapy, have proven effective in breaking the emotional eating cycle, helping individuals lose weight and feel mentally lighter. By addressing both mental and physical aspects of obesity, individuals can experience improved quality of life across the board. Ostearthritis, a joint effort. If you've ever felt like your knees were carrying the weight of the world, you're not far off. Osteoarthritis, the most common form of arthritis, is often worsened by obesity. Excess weight puts added stress on joints, especially in the knees, hips, and lower back. According to the Arthritis Foundation, just 10 extra pounds can add up to 40 pounds of pressure on your knees. Over time, this stress can wear down cartilage, leading to pain, inflammation, and reduced mobility. Losing weight can help alleviate joint pain and improve your ability to stay active, so time to lighten the load on your joints. In fact, a recent study from Harvard University showed that for every pound of weight lost, you reduce 4 pounds of pressure on your knees. Imagine the relief your joints will feel with a little less weight to carry. Non-alcoholic fatty liver disease, a growing concern. Your liver is the body's detox center, but too much fat can throw it off balance. Non-alcoholic fatty liver disease is becoming more prevalent in individuals with obesity. In fact, around 25% of the world's population is estimated to have non-alcoholic fatty liver disease. Non-alcoholic fatty liver disease occurs when fat builds up in the liver, leading to inflammation and potentially liver failure. The good news? Losing even a modest amount of weight can help reverse non-alcoholic fatty liver disease and improve liver function. With the liver being responsible for over 500 functions, keeping it healthy should be at the top of your priority list. Infertility, weighing down your chances. Here's something you might not know: obesity can affect fertility in both men and women. In women, excess weight is linked to polycystic ovary syndrome and other hormonal imbalances that can make conception difficult. For men, obesity can lower testosterone levels and reduce sperm quality, making it harder to conceive. But there's hope. Losing weight has been shown to improve fertility outcomes and increase the chances of conception. If you're struggling with infertility, shedding some pounds might just help you start the family you've always dreamed of. Public health crisis. We're all in this together. The impact of obesity doesn't just affect individuals. It's a public health crisis that places a heavy burden on healthcare systems. According to the World Economic Forum, obesity is projected to cost over $1 trillion annually in healthcare expenses by 2030. The financial toll comes from treating obesity-related conditions like diabetes, heart disease, and cancer. Governments and public health organizations are urging a focus on prevention, promoting healthier diets, and encouraging physical activity. It's clear that addressing obesity isn't just a personal goal, it's a societal responsibility. Thanks for watching. If you found this video helpful, please subscribe, share, and follow us on Facebook and Instagram for more health-related content. If you're ready to take the next step, click the link below to schedule your appointment today. Stay tuned for more health and wellness tips.